For my first cannula, my patient was quite medicated and actually fell asleep while I was cannulating him. I don't think it was anything to do with my technique. I think it was definitely medication induced.
Cannula is a device that you put through, it's pretty much like a needle really, that you put through your vein. Every single medical student needs to know and should know well because as a junior doctor you'll be doing heaps of cannulation.
One of the first cannulas I ever put in as an intern, which means when I was a first year doctor, I think it was my first week in the hospital, I went to see a patient in the trauma bays. It was all very stressful, lots of doctors, patient was very sick, and I had one job as the intern to put in this cannula. So I was ready, I got my kit together, I got all my bits and pieces, I found a vein, I was ready, I put it in, I was like, yes, got flashback, pull back, and then at that moment, as the 18 gauge cannula, which is quite large, blood just started pouring out, and at that moment I realized I had no gloves on.
One job.
I had two choices. One, pull the cannula out. Two, just follow through as blood poured onto the floor and my pants, and I chose option two. I just went forward with cups of blood in my hands. I think the patient bled more from the cannula than from their wounds, but that was my first cannula, and hey, I got it in first shot. Maybe not ideal, but yeah, it worked.
My kind of go-to line is I go, oh, you're really lucky, I get 100% of my cannulas in 50% of the time, and watch their joy turn to horror. I've cannulated an artery before, which is never fun. Yeah, there's like an awkward moment where you notice the blood has a rhythm.
He was a 95-year-old gentleman who had been to the hospital many times. I started putting it in. His skin was, well, quite old, so it took some attempts to get under the skin. And then once I was in, I forgot I needed to grab something else. I released one hand and I wasn't putting enough pressure, and the poor man started bleeding a lot, which is when I asked him, are you on blood thinners by any chance? Yeah, I take it every day. I probably should have told you earlier. So there he is, river pouring out of him. His clothes are absolutely ruined, and he's looking at me with a face of encouragement, of no, you can do this, and why did you ruin everything that I just wore? To this day, I see his very sorry face. Thanks to him, maybe my skills are a bit better now. So thanks, old man.
If you like this video, check out more over here. And if you want to master clinical skills, head to Oscer.